Dear student, we have two important topics in the routines in early care. The first I will explain is diapering and toileting, and the second is sleep routine or nap time. Well, I want to start with this slide. You have some material to check after lecture I'm doing this moment, but I will give you this orientation at the end of the lecture. Well, and we have here the content which say that infant and toddlers are dependent on responsive adult to make them comfortable when their diapers are wet or soiled. Diapering routines are an important part of the day, not only because of babies' comfort, but because they afford many opportunities for quality interaction and communication. The diapering routine has to be carefully considered to ensure the safety of the children being changed, convenience for the caregiver, and hygiene. The area should be sanitized. This is very important because the safety of the children is always the most important. After every use, unsoiled diapers of the child appropriate dispose of, the caregiver must thoroughly wash her hand and the hand of the children with warm water and soap before and after the baby is changed. In addition, caregiver can wash toddler hands to establish a foundation for hand washing as part of the toileting routine. Toileting is also important because it helps children become more independent and establishes a habit of good hygiene. Toileting takes on particular significance in group of toddlers who are in the process of toilet training and young preschoolers who are in the process of mastering or have recently mastered bowel and bladder control. Even with older preschoolers, it is good to remind ourselves that these children were still in diaper just a couple of years ago. Let's continue with some other characteristics of this routine. And teachers in toddler programs are often required to guide the young charge in toilet training. Children between the age of 2 and 3 and sometimes later usually signal the readiness to be toilet trained, often by telling the teacher they have wet or soiled their diaper, staying dry for several hours, or watching with interest as older children use the bathroom. Early pressure to use the both are usually futile and result in resistance rather than compliance. Toilet training should be pleasant, never a stress or punitive experience. Accomplishment should be acknowledged and praised, and accident handled in a matter-of-fact manner. It is particularly important that parents and teachers communicate during toilet training so they are on the same schedule, use the same method, and are aware of progress while the child is not with them. Before toileting becomes a matter-of-fact routine of life. Young children may go through a period when they are especially interested in the act of urinating and defecating, as well as everything that surrounds them. Toddlers and young preschoolers may enjoy flushing the toilet repeatedly, watching others sit on the toilet, or talking about the accomplishment. It is best to react in a matter-of-fact way that acknowledges the child's interest but does not convey shame or self-consciousness about these natural bodily functions. So with young children who are just mastering bladder control, you may need to provide reminders or periodically ask children they need to go to the washroom or to the bathroom. Be particularly aware of signs such as wiggling or holding, which indicate a need to urinate. Some young children are reluctant to go to the bathroom because they fear losing the activity in which they are involved. They are playing with some friends or in the playground or in an activity indoor. Then they don't want to miss the opportunity to still playing with their peers. And they don't want to say, I want to go to the washroom and let the activity they are doing this moment. For this, we need to ask with these reminders constantly, ask a question if they need to go to the washroom. Well, if this seems to be the case, reassure them that you will keep the place at the Play-Doh table or protect the block structure until they return. It's common to find some toilet accidents in a child who are controlled with they do the toilet training. They are not using more diapers or they are using underwear and something happened and these accidents are inevitable. Children who have just recently mastered bladder and bowel control may not yet have the time and workout, perhaps getting caught up in play and not leaving an activity quick enough to get to the bathroom. Older preschoolers and at times primary school children will also have periodic accidents which should not be a cause for concern or shame. It is critical that teachers handle toilet accidents gentle and sensitively. One contributing factor to accident may be the clothing that children wear. For young children to be independent, they have to be able to get their clothes off easily and quickly. Small buttons, overalls, belts, and back fasteners can frustrate a child trying to undress to use the toilet. Simple clothes with elastic waistbands are the easiest for children to handle. Sometimes children will suddenly have repeated accidents long after they have achieved toileting independence. If this is the case, it would be wise to try to determine the reason for this behavior. Children will react differently to toilet accidents. For some, an accident will be embarrassing and upsetting, whereas for others, it will be at most a minor irritant. In neither instance should a child ever be lectured, shamed, or chastised for a mishap. Accident should be handled in a matter-of-fact manner that does not call attention to the child around and convey acceptance of the accident as no big deal. Any school should have a supply of extra underwear, pants, and socks available in case of accidents. For a group of young children, families might be asked to bring a chain of clothing for possible mishap. When children have an accident, the teacher should furnish the needed chain of clothes and encourage them to chain themselves. Make sure a child has privacy to avoid embarrassment or feel ridiculed by others. Also, keep a stock of plastic bags for storing soiled clothes. Well, now let's focus in bathroom facilities. It's beneficial to children if toilets and sinks are child-sized and easy to reach. Most of the daycare use all the furniture and washroom in a child size. If only adult facilities are available, sturdy white steps should be placed in front of toilets and seen to promote independence. Children should also be able to reach toilet paper, soap, and towels with ease. Having to overreach can cause accidents. Bathroom should be adjacent to the classroom and easy to supervise. Children are more likely to have an accident when they have to ask for permission to go to the bathroom than when they can go on their own when they need to. Some schools have one large bathroom that all of the classroom share. Then a bathroom for each class. If so, teachers need to think through an arrangement that promotes independence, but still lets them know where each child is at all times. Children should not be taken to the bathroom in large groups. Such a procedure in which children have to wait unnecessarily only promote pushing, shoving, frustration, and even toilet accident if a child just can't wait. The same ratio you are handled with the student into your class, it is 1 ECE in a toddler classroom with 5 children is the same they needed. Each caregiver need to bring to the washroom together because they can supervise clearly. When they are in preschooler, they are more commonly to go alone to the washroom, and when they are in kindergarten, that ECE and the other caregiver need supervise in all the time how many minutes the children need to go to the washroom. There are some cases where children stay a longer time in the washroom because they only want to stay sitting there. That, well, it is a moment that caregiver go and tell them that need to return to the classroom and prepare some others issues, other activities. Well, now we have the second part of this combined lecture. Now we'll work with nap time. This is another routine. And after this, we'll explore some documents in group work. Additional, you need to check the articles posted in both PowerPoint posted here. And thank you for your attention, and let's continue with the second part.